Hi folks, I'm Dr. Ed Beyer. Today we're going to talk about reason number 7. Reason number 7 out of 22 in my series of 22 ways our thyroid cannot function properly. Look, I see people all the time very frustrated, especially females, because thyroid affects females 90% of the time. They come into my clinic, Dr. Beyer, I'm gaining weight, I'm losing hair, I got digestive symptoms, I got no energy, I sleep, I still don't feel rested. Their lives are miserable. They're going to their doctor, they're getting their TSH checked, they're told everything looks good, or we're going to adjust your medication this way, that way, and they're still frustrated and not getting to the solution. And the reason why is because there's multiple ways the thyroid can go wrong. Today we're going to talk about reason number 7, and it's one that I see quite a bit in my practice, and that is due to high cortisol. Cortisol is a stress hormone that comes from our adrenal cortex, and when it's high, it's going to cause our TSH to go low. Let me explain. The hypothalamus and the pituitary gland are in the brain. The hypothalamus and the pituitary gland they're in the brain, and they are our air traffic control tower of all of our hormones. What happens is these two areas of the brain will detect when our thyroid hormone starts to go low, and the pituitary gland, when that happens, if it's working properly, will release a hormone called thyroid stimulating hormone. Thyroid stimulating hormone is not a thyroid hormone. It is a brain hormone. It's the main marker that endocrinologists look at to determine the function of the thyroid gland. It's not a thyroid hormone. And then it's going to stimulate the thyroid gland and cause it to produce some T4 and T3. Now, TSH should be between 1.8 and 3 functionally, not 0.5 to 4.5. Many doctors use lab ranges. We don't use lab ranges. We use functional healthy people ranges. So we've talked about that earlier, but I want to mention it again here. So hypothalamus and pituitary gland are the parts of the brain that control thyroid production. Cortisol is a stress hormone that when it is elevated, it shuts down the hypothalamus and the pituitary gland, leading to low TSH and less thyroid production. Now, I can't say that any more clearer than that. When cortisol is elevated, TSH tends to go down because it shuts down these areas of the brain. Now, what would cause elevated cortisol then? Again, because I really want to know why someone's thyroid gland is not producing the hormone. High or low blood sugar will do it. Well, let me tell you, a lot of my patients are coming in with poor, unstable blood sugar. Anemias will do it. Anemias will cause elevated cortisol, low TSH from the brain. Inflammation. The hypothalamus and the pituitary gland are loaded with receptor sites for the chemicals of inflammation, and the hypothalamus and the pituitary will shut down when someone's inflamed. That, by the way, will also decrease the ability to lose weight. Your metabolic set point will raise. So when that area of the brain is not healthy, it's almost impossible to lose weight. The standard American diet will elevate cortisol because the standard American diet is very inflammatory and very stressful. Alcohol, tobacco, caffeine, corticosteroid medications, which many people are on, will shut down the pituitary gland. Nutritional deficiencies, especially B vitamins, some genetic mutations like the MTHFR mutation, the inability to convert inactive B9, which is folic acid, into methylfolate, lack of sleep, and different psychological stresses. These are just really a long list of why cortisol could be elevated. We have to really identify all the reasons why someone's thyroid is low. Let me tell you, high cortisol is a very common one that I see clinically in my clinic. I'm Dr. Ed Beyer. I hope that helps. Have a great day.